Good afternoon, everyone, and welcome to Grand Rounds. I'm Tom Farden, and I organise Grand Rounds. And as you can tell, I'm not in my office today. I'm meant to be in the south of France, but here I'm instead in the Riviera de Fife instead. It's a beautiful day. I'm sorry if you're cooped up inside an office, but it's lovely out here. And perhaps that segues very nicely into the topic for today, which is climate change and its impact on health. Munro Stewart is a local GP here in Tayside and is the Tayside representative for the RCGP Committee on Climate Change and Health. And he's, by somewhat of a coup, has managed to get the lead author from the recent Lancet Commission on Climate Change, Nick Watts, to come and speak with him today. Now, as I'm on holiday, I'm going to nick out just now and leave you in the capable hands of Munro for the rest of the Grand Rounds. So if you have any questions, please put them into the chat box on the side, and Munro will deal with the questions at the end, and I will see you again next week. This Grand Round, like all of us, will go online at some point once I've edited the videos, but there might be a bit of a delay as I am. So I'm sorry that I'm going to miss the talk just now, but I will catch up with it on YouTube. Munro, thank you very much, and Nick as well. Okay.
Thanks, Tom. So this talk is intended to develop on previous Grand Rounds by Jackie Hyland and Sarah Birkby, who looked at pollution and health and climate change too. As Tom mentioned, we've got an expert speaker for the first half, Dr. Nick Watts, who's the lead for the Lancet Countdown, also working with the Sustainable Development Unit in England, and also a medical doctor. For the second half, you've got myself, a non-expert speaker. I'm here through a combination of flygskam, the Swedish for flight shame, and ecological grief. And as Tom mentioned, I'm working with the RCGP on climate stuff. Now, the aim of this talk is to give us, as clinicians, the information and the latest evidence that we need. The public view us as being the trusted messengers, so it's only right that we have the correct information. And the landscape's changed with the new context of COVID. We'll look at the COVID landscape and how it affects climate and vice versa, the Tayside situation, and some low-hanging fruit. I also want to acknowledge there will be a large amount of crisis fatigue here, but unfortunately, COVID's not going away and neither is the climate crisis. But the change in landscape does leave us with opportunities. It's a big subject and there's going to be a series of talks as well. But at this point, I'll hand over to Nick. I'll just give him a chance to get his slides up on the screen there.
All right, you can see some slides?
Got them.
Perfect, okay. And that means you can hear me as well, which thanks very, very, very much, Munro, for the introduction. Tom, no thanks whatsoever to you. I have no interest in being shown your fantastic holiday setting, and I hope whenever you listen to this on YouTube, you feel a little bit guilty about that. But I also hope that you're not listening to this now and you're back safely and in holiday mode. We have a little bit of time. We have sort of 15, 20 minutes. I'm going to talk through. Munro, I think you're gonna pick up as well on a few bits and pieces. The one thing I should note is it should be very apparent to everyone here, who I think the audience should be mostly Scottish, that I am mostly Australian. My accent hopefully still shines through. If it hasn't, I'll need to do something about that. If you can't understand anything I'm saying because of my accent, there's absolutely nothing I can do about that. I promise I have tried. I think, and I'm maybe speaking a little bit for myself and for Munro as well, but I think there are three key things that we're going to be talking about, three key messages that you may hear coming through again and again and again over the next 45 minutes, hour or so. Number one, the health impacts of climate change, they are unequivocal. We're not talking about whether or not they're happening. They are happening today, and we're no longer talking about whether or not they're happening in 2100. And they are potentially irreversible. They affect everyone. So the health impacts of climate change, they are unequivocal. They are happening right now, and they're affecting populations around the world today. There's an impact story. Number two, we've known this for quite some time. The Lancet published its first paper on the health impacts of climate change in 1992. 1991, the British Medical Journal did a similar piece. New England Journal of Medicine, a little slow to the game, 1994. And they have taken that up over the years. We have known about the health impacts of climate change for a very long time, and broadly we have done nothing. Broadly, we have done nowhere near the level of action that we need in order to respond. So impact, delay, those are the two things I'm going to focus on, because I can be a little bit depressing from time to time, but thankfully we have Munro here, who's going to talk about optimism and some of the things that you can do to deal with that. I think just in the last 5 years, and a couple of key sectors that are really, really important to human health, in power generation, in transport, in physical activity, we are starting to see some really impressive shifts all the way around the world. Indeed, in healthcare as well, in the healthcare setting. The United Kingdom, Scotland, England, some of the best health systems in the world out there in terms of their response to climate change, both in terms of what they're doing to adapt to the impacts, but also in terms of reducing their own emissions. Impact, delay, optimism. Those, I think, are the three key messages from today. I work with something called the Lancet Countdown. We are a collaboration of way too many academic institutions scattered around the world, scattered across every single continent, a couple of UN agencies thrown in there just to cause extra trouble. We, health professionals, we're paid to disagree with each other. We do a really simple thing. Once a year, we put a finger on the pulse of the planet. We try to figure out the links between climate change and human health across 41 different indicators. We put this out and we track that every single year, anything from shifts in extremes of heat or flood or drought through to the spread of infectious disease. Previously, we have tracked Vibrio, malaria, dengue fever. This year in the report that's currently going through peer review with the Lancet, literally as we speak, it's at the editorial board meeting. We've added in some new indicators tracking chikungunya and Zika and yellow fever as well. But we also track things like shift in road transport and what that does to air pollution and what that does to physical activity, both the negatives and the positives there. Every single thing we have, all of our data is publicly available. We are expert in producing graphs, far too many graphs. We have a really great data visualization platform, which is up online. If you're interested in what's happening in your own country, you can go to this and take a look. If you're Australian, like me, you may be particularly interested in comparing what's happening between Australia and New Zealand. It lets you do that. Unfortunately, Australia rarely comes off well. Please don't be afraid, though. We are also expert as well as in producing graphs that make absolutely no sense to anyone at all. So not all of them will make sense as we go through over the next couple of minutes, but all of our data is publicly available and you can look through that yourself. I promised 3 messages. I'm going to deliver 2 of those 3. We are at a turning point. We're at a turning point just now, 2019, 2020, where the life of every single child born today will now be profoundly affected by climate change. Going forward, a child born today will be the first child that will have to grow up and experience, not just look at graphs of, but experience what it means to live in a 4-degree world. Should I be paying attention to some of these chats? I see. Munro, I think you responded to everyone by responding to me. A child born today will grow up in a 4-degree world. And so that means suddenly that we're not talking about things that are happening a long way in the future. We're talking about that child's life being affected from the moment that they're born the whole way through. And experiencing a 4-degree world is difficult. We have a pretty good sense of what that looks like from a climatological perspective. There's been a lot of work going into what that sort of heating looks like, what it looks like in terms of extreme events. What we have no idea about is what the health implications of a 4-degree world are. But we know that services like the NHS in Scotland, like the NHS in England, like the Australian healthcare system, they were designed with the assumption that the climate was stable. And it turns out that it is, and it turns out it's moving pretty rapidly. And so when we look at what that means, and I told you that as we go through, we're going to be talking about a lot of data up to present day, up to 2018, up to 2019, up to 2020, because we're seeing those effects already. So when we look at some of the things that are going to hit us earliest, we talk about extremes of heat. We talk about an additional 220 million vulnerable people exposed to extremes of heat, to heat wave around the world. Now that is concentrated in India, it's concentrated in Pakistan, it's concentrated in China, Japan, in terms of population numbers. But what's really important to realize is that it is European and British populations that are particularly vulnerable. And that's because we have an older population. It's because we have a population more susceptible to some of that chronic disease that might put you at risk. And it's because the building stock is quite old. And so those adaptation measures don't quite exist. So you have those exposures of 220 million additional vulnerable people that we're seeing just as a result of climate change up to present day. But we also have then the effects that has on outdoor workers. And we talk about an additional 133 billion hours lost. This is people trying to work outside. It turns out when it gets too hot, and I know about this from Australia, it's just really difficult to conduct physical activity, to conduct physical labor. And if you work in construction, in agriculture, your life is already being affected by that. And you're facing a difficult decision about whether or not you engage in that work or whether or not you experience some of those health impacts that come from that. And those extremes of heat, we're talking about things like exacerbations of congestive heart failure. We're talking about spikes, these little strange epidemics that are happening across South America and the south of the United States in AKI, because you're seeing these agricultural workers that are out and dehydrating far, far quicker than they previously would be. And the CDC is trying to figure out different ways of dealing with that. We move from heat to food security. Around the world, and we track, we actually track 5 major crops, but five graphs don't fit on a PowerPoint slide quite so neatly. So here's 4 of them. Around the world, just up to present day, we are seeing enormous shifts in crop yield potential. Somewhere between 2 to 4% reduction in global crop yield potential. We take a climatologically stable baseline back in the 60s and 70s, we average that out, and we shift through and we look at a global level what's happening. You see these reductions, which are really quite significant when we consider just how many people are already malnourished around the world. Projecting forward, so this goes up to present day, but projecting forward, we expect to see an additional 7 million children under the age of 5 malnourished as a result of climate change in sub-Saharan Africa, an additional 9 million children malnourished across Southeast Asia. In Australia and Scotland, we may be doing okay. Because we have some pretty robust food systems that are robustly connected to global food markets. I suppose it's important to note the impact that a food shock can have on our population in Egypt and what that does when a prolonged drought interacts with that food shock in Syria, and you see a mass migration event sort of move across Europe, as we've seen in the past couple of years. It turns out that when you shift things at this sort of level, across the world, when you shift the entire system, no country, regardless of how robust your food system is immune from those effects. And then I talked about infectious disease. Asian tiger mosquito, the United Kingdom Public Health England found its first endemic case of that. It wasn't carrying anything, but it has been found to carry dengue fever across Germany and across France just in the last 6 months. It wasn't so long ago that Germany itself actually had endemic malaria. 9 out of the 10 most suitable years for the transmission of dengue fever, climatically suitable years for the transmission of dengue fever have occurred since 2000. We see roughly a 7.2% increase in that for Aedes aegypti, 9.8% for Aedes albopictus. What we're tracking here is the vectorial capacity for that transmission. And we do that because we're trying to isolate the climate signal. We know that the incidence of dengue is increasing. What you need to do is figure out why. 3 really clear reasons around the world, right? Trade, urbanization, and climate change. We track this not just for dengue, but we track it for malaria, we track it for Vibrio, and hopefully eventually, if we make it through peer review, we'll have something to say about chikungunya, Zika, yellow fever. You can follow these the whole way through. You can follow these impacts the entire way through the different pathways, as well as a whole bunch of graphs that that sometimes can be a little unhelpful. We also produce figures that have far too many diagrams and arrows and perhaps can confuse a little bit. I don't think this figure is particularly useful unless you have 45 minutes to sit and stare at it. But what it does for me is it reminds me that I'm not worried about any one of those impacts. I'm not worried about just heat wave, and I'm not worried about just dengue fever, and I'm not worried about just flood and extreme storm in the United Kingdom. What I'm worried about is when more than one of these effects hit again and again, when climate change correlates previously uncorrelated risks, and you start to have a population who is managing malnutrition because there was a flood that covered 1/5 of its land mass and wiped out half of the power supply for its hospitals. And that would have been okay, except that flood came back. And normally that flood only comes once every 500 years, but instead it came back again 2 years later. And instead of 1/5 of the land mass, it flooded 1/3 of the land mass and kept it flooded for 9 months. And suddenly Pakistan is struggling with repeat flood. It's struggling with power failures for its healthcare system. And it's struggling with a malnourished population that is experiencing spikes in waterborne disease. And those previously correlated risks start to line up. And you see that across the world in case studies all over the place. The human symptoms of climate change, they are unequivocal, they are potentially irreversible, they are affecting populations around the world today. That's that impact message. The second message there, the second thing that I think we need to remember is that we have known this for quite some time. This is not new. We have known about the impacts of climate change for quite a long time. Margaret Thatcher referred to climate change as one of the defining challenges of a generation. The science here has only strengthened and only improved. And yet, for the last 2 decades, for the last 3 decades, we have seen a delayed response. Just to talk about what that delayed response might look like. And then, Munro, I'm counting on you to be positive and uplifting. Is that okay?
I'll do my best.
Yeah, great. Thanks, Matt. Just to talk a little bit about what that lack of response might have looked like. This here tracks the carbon intensity of the global energy system, okay? So how much carbon are you producing per unit energy? You can see the line graph there is tracking this by country, and then the bar graph in the background, which follows that, the y-axis on the right-hand side, is tracking the total use of fossil fuels across the world. What we see is that there have been some impressive shifts in the United States. There have been some impressive shifts in North and Western Europe, and that has decreased the carbon intensity of its energy system. But at exactly the same time and almost at exactly the same pace, the intensity of the energy system in Southeast Asia and in Southern Asia, and really when we're talking there, we're talking about the 2 major players there, China and India, have increased the carbon intensity. And so the most important part of this entire graph you should look at is the part that is almost impossible to see by design, of course, is that little black line across the middle there. That's the global shift. It's been flat. The carbon intensity of the global energy system has remained flat since 1990. That has resulted in a huge spike in cumulative emissions over that period of time, and that is bad for the climate, which in turn is bad for human health. But what's really bad is that fossil fuel combustion leads to mortality through pollution, through air pollution, which it sounds like you guys talked about last time round. We know that there are over 1 million deaths that happen as a result of coal-fired power around the world, most of them concentrated in China and India. Mostly as a result of premature mortality from heart disease, partly from stroke, partly from chronic lung disease. But it goes a little broader than that. And when you actually take the broader picture, the total sort of mortality burden that comes from the combustion of fossil fuels is probably a little closer to about 7 million deaths every year. If you combine indoor and outdoor air pollution, it's the single largest risk factor out there for burden of disease. The problem is sometimes we break it up into a few too many different components because we don't realize that everything there is just at its very, very heart, the combustion of either coal, oil, or gas. And then we go and take a look at what's happened in terms of access and use to clean energy. Almost 3 billion people around the world live without access to clean cooking fuels, to technologies. We have seen really very limited shift in that over the last 2 decades. The latest data we have here, this stops in 2016, the latest data we have here goes forward to 2020 or to January 2020. It gets a little bit better, but I have to say not an enormous amount better. And it's these sorts of things, I think, that lead us to our first message, which is about the life of that child born today that's experiencing that 4-degree world as they grow up. Average life expectancy is 71.5 years around the world today. We expect to hit 4 degrees on a business as usual scenario well before the time that kid reaches 71 and a half years old. It's what leads us to talk about that delayed response and the impact that that has had over the last 3 decades, and the fact that we really have known about this for a long time, but not done nearly enough. But just to set you up, Munro, it's really important that we remember that there is a second path, that that child born today does not have to grow up in that world. And in fact, there are countries and there are examples and there are health systems around the world that have done some really exciting, really, really impressive things to respond to climate change. Just with the current commitments alone, a kid that grows up in the United Kingdom, a kid that grows up in Canada will grow up not knowing what a coal-fired power plant is. They won't know what that mortality burden looks like because they won't see one, because they will be phased out by the time they get to that point. A kid growing up in France, they won't be able to buy a diesel or a petrol car. France will have phased out all diesel and petrol cars by the time they get to the age of wanting to buy one of those. And if we're lucky, if we do it right, they won't want to buy a car at all, because we will have designed cities that encourage physical activity, and we will have shifted the way that work works so that they can live in a more sort of healthier sort of place-based, kind of thing. And then finally, I think maybe not if they're born today, but we've just seen from our beloved Prime Minister Boris Johnson an announcement of an accelerated plan for 40 new hospitals. That's good. You can have long and detailed discussions about investments that different health systems across the country need in England, in Scotland, and everywhere else. What he didn't say, which is just as important, and it is there in a footnote, is that those 40 new hospitals, those are going to be net zero hospitals. That there's a commitment to hit net zero by 2050 for the government as a whole, but the NHS England is looking at doing that much, much quicker, maybe 10 years, maybe 20 years quicker. That's really, really exciting. If I was Scotland or if I was Australia, I'd view that as a challenge. I'd want to see if I can go a little bit quicker. Certainly, I know that Australia, we view that as a challenge from the English. But those are the sorts of things that child born today, can grow up with. They can grow up seeing a net zero hospital. They can grow up without coal-fired power. They can grow up in a more livable city without diesel petrol cars. Those are my 3 messages, and that's the entirety of my time. Thank you very, very much. Munro, I'll hand over to you.
That's excellent, Nick. Thank you very much for informative, entertaining talk. If a little stark with the reality of the situation, but some cause for optimism there. So I'm going to lead on from that and look at how COVID has changed the landscape of dealing with climate, and give a bit of an update as to what's happening in Tayside and maybe where is next. We'll look at how pandemics and our relationship with the environment are linked, how we've communicated around COVID, the emissions, service and technology changes, particularly in the health service, inequality, waste, and then a bit of a comparison to give us an idea of scale. So our relationship with the environment, we know this is a factor in pandemics. The loss of habitat, for example, deforestation. If you cut down all the trees, the bats don't just go away. They'll start living in, for example, barns. We come in closer contact with their feces. And certainly bats have been linked to COVID in China, and Ebola. The African fruit bat is a known vector and possibly the original cause of Ebola as well. Industrial farming should be mentioned too. Persistent low-dose antibiotic use increases the risk of multi-drug resistant bacteria. So again, our relationship with the environment is increasing the risk of infectious disease, which was given in further detail by Nick. How we communicate COVID or how we have communicated around COVID has been interesting. I think people have been able to see that it's a global problem. They've been able to see how one country's actions can impact another. It's also quite difficult for individuals to get an idea of how their actions are part of a systemic effect. But I think COVID has done that. Through the lockdown, people can see that their actions have led to reducing that rate of infection. And hopefully we can use the lessons of showing how individual actions are part of a systemic effect for climate as well. We've seen what can happen with a common purpose. There's a very positive appreciation of the NHS, trust in science, demand for data and facts. And we've also seen what happens when one subject dominates the media, how much we can do. And I think it's worth considering what might happen if the government was doing a an emergency update on the climate, perhaps even a quarterly update from the government on where we are with the climate crisis, what they're doing, what we need to do. I think that might focus the mind. So let's have a look at this flatten the curve graph. This is something that's been widely shared and widely understood. The healthcare system capacity being the dotted line, and two different scenarios based on the rate of infection. High rate of infection, overwhelmed healthcare system, higher death rate. This graph originally comes from a 2007 American Center for Disease Control pandemic planning report. But we can use this shape of graph, although not strictly accurate, but we can use the shape of graph to give people an idea of other things. For example, the concentration of carbon dioxide in the atmosphere might be a difficult thing for some people to get their head around. That dotted line there is the concentration of carbon dioxide that is widely accepted as what we need for a stable climate. So pre-industrial concentration was 280. We're up at now somewhere between 412, 418, and we last saw 350 in the early 90s. Another way we could use the graph shape is to look at our use of planet resources. So we're currently using 1.7 planets worth of resources every year. Obviously, that's unsustainable. It's already causing reduced nutritional value and crop yields. But basically, the point of these two graphs is to show that we can use the lessons from COVID as to how we communicate things that could be difficult to communicate. And that is the climate crisis. Now, we know that there's been less cars on the road, less planes in the sky, and that has reduced the emissions slightly this year. Now, that's not reducing the concentration of carbon dioxide in the atmosphere. It's reducing how much extra carbon dioxide there is each year. There's lots of different projections, but it looks like it might be somewhere around an 8% decline in 2020, which gives us an idea of what it might look like to get these annual cuts of 7.6% needed to avoid catastrophe. Service and technology, the NHS has responded amazingly well. There's been rapid adaptation, particularly things like telephone and near-me consultations. I won't go into this in much detail. It's been covered well at previous grand rounds. Chris Schofield was talking about how services are being questioned and redesigned. But I would say that organizations are more malleable than we thought. We have seen rapid changes take place. Things that might usually take months or years have happened in days and weeks. And while we are redesigning services now, that does give us a big opportunity. COVID's forced our hand a bit, but the structures are more malleable. And we've got the opportunity to add an environmental impact assessment to everything we do to shape these services to suit both COVID and the requirements of the climate crisis. Can't mention a crisis, inequality, can't mention a crisis or COVID or the climate without mentioning inequality. This graph here from Public Health England. So the bluey-greeny bar there shows the death rate pre-COVID, and the green bars are the deaths from COVID. So you can see that a black British male is 3 times more likely to die from COVID than a white British male. The reason I mention this is, much like COVID, the climate also has an unequal effect. It tends to hit those most vulnerable hardest, usually those in the developing world. France ordered 2 billion face masks. We've obviously been using a huge amount of PPE, single-use, non-recyclable stuff. Rod Mountain and others have been looking at this, and it's a talk for another day. So if we use World Health Organization's death rate, their number of deaths in millions annually, ischemic heart disease, stroke, COPD, lower respiratory tract infection. Now, the next 2 bars here, one of them is air pollution. In fact, it's just air pollution from particles, PM 2.5 micrometer particles. And one of them is from COVID. So the smaller bar there is COVID deaths at just over 500,000. And the bigger bar there is from air pollution deaths. Now, this is direct emission effects that Nick went into a bit of detail on. And this is only one part of the emission effects, not even looking at the effect of the emissions on the climate and the concentration of CO2 and all the effects that we know that has. So we've talked about the inaction, and we know that our actions and our emissions are causing harm now. So why are we not dealing with it? Russell Duncan did a very useful talk a few years ago on how we think, and mentioned cognitive dissonance as one of the, when you know something, but your behavior doesn't match your action. And there's evidence for behavioral science pointing to a few other things as well. It can be our perception of immediate threats, which trump those that we perceive to be in the future. So COVID is clearly an immediate threat. We've been dealing with it, but we wrongly perceive climate to be something in the future. And unfortunately, as it should be clear from the talk so far, this is something that's causing harm now and it's going to get worse. It can be that the climate feels difficult to picture its effects, or maybe it doesn't feel close to home. Sometimes people have more loyalty to their tribe or their tribe leader than to the truth or facts. Perhaps we feel we're already at capacity. We already feel we're too busy to take on another problem, although we have managed pretty well with COVID. Often clinicians report it should be someone else's job or responsibility. There can be resistance to something inconvenient. There's a perception that the changes will challenge our way of life, although there's evidence pointing to the improved quality of life with so-called green interventions. Perhaps there's a bit of, specifically to medicine, perhaps there's a bit of intellectual snobbery, that perhaps there's bias, that the evidence behind green interventions isn't as important as the evidence behind the latest drug. But whatever the cause of inaction, there are obvious parallels with COVID of experts warning of a problem, but not enough action being taken early enough. But we're in that position of choice now. We're informed of the evidence and we're able to choose what we do. Who's responsible for these emissions? This is a graph of percentage of CO2 emissions by world population. The richest 10% responsible for 49%, or just under half of total lifestyle consumption emissions. To make that richest 10%, Credit Suisse last year said you had to have net worth of around £88,000. And it's harder to get the figures for the top 20%, but I think it's fair to say everyone involved with this talk or watching this talk is going to be in the richest 20%. So we are largely responsible for emissions and our actions. Another good illustration of lifestyle emissions is the fact that only 6% of the world's population has ever set foot on a plane. References in the bottom corner there. So COVID and climate summary. Future pandemics are, well, they're ongoing and they're increasingly likely because of our relationship with the environment. Inequality usually worsens in crisis, but this changed landscape has given us a major opportunity. COVID has changed things in a lot of ways, and it gives us a major opportunity, I suppose, specific to what we're doing at the moment, and that explains the timing of this talk, is we're designing systems, we're changing what we do in medicine. We've got the choice now to decide what do we keep and what do we change. And many people have described COVID as a rather painful and traumatic dress rehearsal for the bigger problem that is the climate crisis. Right, time for a quiz break. If you put your answers in the chat, whose 1982 graph accurately predicted the temperature increases with rising CO2? So along the bottom is the year. Up the left is that atmospheric carbon dioxide concentration that we've been talking about, and up the right is the temperature from 1982. And this has been an accurate predictor. Now let's see if there's anyone in the chat who knows. So this is not the IPCC. They were 1988 that they were formed. Excuse me. It's not NASA. This is actually Exxon, as in now ExxonMobil, the oil company. Now, Exxon knew what was happening, but unfortunately, rather than spreading the word and changing what they and we do, they decided to cast doubt on the evidence. And in fact, the most vociferous opponents of tackling climate change are often very well informed. So Margaret Thatcher saw this as a major problem. The UN see it as the climate as the greatest threat to security. This is also recognized by the Pentagon and UK Armed Forces too. So another question for you. In which year is this the expected annual flood level in Dundee? So this is Kopp et al.'s moderate projection of sea level. There's a more pessimistic projection, but I've spared you that one. So this is not 2100 or 2050, this is 2030, which might affect this audience, the demographic of this audience by trips to their beloved V&A museum, or perhaps parking at Marks and Spencer's, but certainly it's coming. So in Tayside, we are already affected. The sea levels will rise here too. We are affected. We have two of the most polluted streets in the UK, Seagate and Lochee Road. There will be probably around 200, or probably more than 200 deaths a year, which will be attributable to air pollution in Tayside as well. But let's talk about some of the examples of good practice and more about the opportunities. And if you can get menti.com ready in a browser for at the end, that would be useful. So the NHS Tayside Sustainability Group, now this is largely run by management, Philip Wilde in property, John Ruddy in energy, Andy Hay in procurement, amongst others, Joyce Anderson in waste, catering have been doing a lot as well. It's chaired by Rod Mountain, who's spoken recently on his work with scrubs and reusable gowns and now masks. He's been working with a local business, Hallie Stevenson's, who also provide the material for reusable masks that you can see at the bottom there, for an Edinburgh company called Breathe Easy with a port for lip reading. As a department, the anaesthetics department are probably leading the way with their work on cutting the use of a potent greenhouse gas, desflurane, which is used in anaesthetics, as well as a lot of work on the waste streams. So there is a sustainability group here, although it's probably not through the whole system as much as we need just yet. There is good work ongoing, and I'm sure there are lots of examples of good work that could be shared. So NHS Tayside has looked at some of its carbon footprint here, and that purple line shows that it is coming down. There is some progress there, although there's a lot more work to do. And this is largely around electricity and efficiency of our heating production. Now, the Scottish figures are a bit out of date for breakdown, but we can use NHS England's carbon footprint for a breakdown of where the health services emissions are coming from. And we know that healthcare contributes 4.6% of the global emissions each year. So healthcare is a significant contributor. So largely it's procurement, and specifically pharmaceuticals are about 22%. There's buildings and direct energy use and patient and staff travel as well. To break down this graph further, there is this rather confusing graph, but if we go straight to the biggest bar there, so orange is primary care, and the tallest part is the pharmaceuticals. It's not perhaps surprising that this is the biggest individual part, bearing in mind 90% of patient contacts happen in primary care. But let's look at what we could do with this biggest part of the NHS's carbon footprint. Now, this is a graph looking at the whole life carbon footprint of inhalers for a year's use by one patient. The average UK citizen has a carbon footprint of about 10 tonnes. And so you can see with the two serotype inhaler, the brown and green there, you could be up at nearly half a tonne from two inhalers. But this isn't all inhalers. This is metered dose inhalers in particular. So these are the little ones with a canister of a propellant, which is a greenhouse gas. There are other options though. There's dry powder inhalers or soft mist inhalers, which don't have the same carbon footprint. And you can see if you change from the serotype evohaler and Ventolin evohaler to an AccuHaler, an individual can dramatically reduce their carbon footprint, with some comparisons on the right-hand side, which you can have a look back at the YouTube later on. Now, Tayside is working on this. The Tayside Respiratory Network, led by Phil Short, are working on this, but the onus is really on GPs. Already on the formulary, there is a dry powder or soft mist inhaler alternative available for most of these as a first choice on our formulary. So we'll be working with GPs in the coming months to look at how we can safely do this. Patients need to be able to have a good enough inspiratory flow. They need to be able to be safe to use these inhalers, so it needs to be clinically suitable. But there are some big gains to be had here. Now, Brian McGregor, pharmacy data analyst, pulled out our local figures just last week. Sweden uses about 13% metered dose inhaler with these propellants. England about 70%, and Tayside we're up at 75% there. So there's obviously room for improvement. There's more information at greeninhaler.org, and there's a link at the end for a further presentation on this tomorrow. We can make a large dent in the carbon footprint of inhalers just by recycling them. And there is a GSK complete the cycle scheme most pharmacies in Dundee use. We can get almost half the gains in saving emissions by recycling. So let's have a look at opportunities in Tayside. Tayside was widely credited for our response to COVID, which was based around following the evidence, a collaborative approach, and making our own mind up about what was the right thing to do. We have the same opportunity to lead on climate. As Nick mentioned, Scotland's a little bit behind England, particularly Newcastle are leading the way, but there is the opportunity there to lead as well. We've also got the opportunity to tackle existing problems. We know that these green interventions have major mitigating, the mitigation has major health co-benefits. It can help us tackle existing problems like mental health, obesity, and loneliness. If we reduce our use of fossil fuels, we'll also cut emissions and save money. And how we do this has been good examples from Rod Mountain of using Tayside's strengths. So if you identify a problem and then you take that problem to others who can find a solution, an example would be his presentation recently on using the university, the design expertise in the city, and then also the volunteer resource. When volunteers were sought for COVID, far more people came forward than could be given roles. So there are resources and there is expertise in Tayside. Obviously, we need to keep some of the gains from COVID on reduced patient journeys. But something else I'd like you to think about is the fact that the NHS is the biggest employer in Europe. So when we're looking at how do we make a change, how do we get things to start moving, there's also information from Erica Chenoweth at Harvard, amongst others, that it takes about 3.5% of a population, as a rule of thumb, to form a groundswell of opinion, if they're active, to change what's happening. NHS Scotland employs 3% of our population. So we're already pretty much there. If our NHS population is educated and acting on this, we can also start the groundswell of action that can make a major change. Also, the NHS, on its influence on its huge supply chain, there's examples in the past of scanners, for example, the requirements of the NHS changing how the supply chain acts. So the NHS is a huge organization that can have a major impact and can lead the way. So we've talked about the health co-benefits of climate mitigation and adaptation. And there's an organization specifically set up for this in Dundee, the Dundee Green Health Partnership. The Green Health Partnership is a service that we can refer to via a green health prescription instead of a medical prescription, which of course would be great for reducing emissions and all the health co-benefits. And patients can self-refer here as well. There's loads of evidence. There's a good social prescribing evidence map from NHS Wales. And some of the examples of things going on would be conservation, arts and crafts outdoors, supported walking, football and netball, gentle cycling, family walks. There's a lot of evidence that this stuff works, and there's a resource there that we need to use. So a Tayside outline, there is action underway. There are people are trying to change. The evidence shows that we're probably needing transformational change rather than incremental change. So we need to accelerate a bit. There's some low-hanging fruit here with the inhalers and the example of desflurane, which is, there's been a lot of progress by the anaesthetic department. There are resources that we can use, like the Green Health Partnership. But really, we also need new solutions. We need people to find in their departments, we need what solutions work for them. We need them to use their expertise. We need a climate champion in every department, and also to share the work that's ongoing, so we're all pulling in the same direction. Probably the simplest solution is that we consider the environment with every decision we make. Now, there is the NHS climate strategy due at the end of this year. How much detail that has, we don't know. And there's also the law for 2045. But there's a lot of work in the meantime that we need to do to get there. Some further information, if you're looking for a bit more, there's the Lancet Countdown, which is an excellent resource. I should also mention that the BMJ has now got an Anthropocene series, which is very good. Our beloved David Attenborough and his Climate Change, The Facts and iPlayer is a great place to start. And this book written by the negotiators for the Paris Agreement, The Future We Choose, is also excellent. For GPs, there's the Green Impact Toolkit, which I would recommend, and I'm going to be working with practices in Tayside and spreading the word, but please have a look at that and get started, because that will guide you towards carbon net zero by 2030, exactly how to do it. If you want to know more about inhalers, there's an RCGP webinar tomorrow lunchtime. And I would like to hear from anyone who's interested in this stuff as well, as we build the sustainability group. If you fancy going to menti.com 872500 and answer a wee question on there, that'd be really useful. So in summary, this is a big problem. It is a health problem now. It's a growing health problem. There is urgency. We haven't really gone into too much detail, but there are also tipping points that are coming up now that really makes this an urgent problem. COVID has slightly pushed climate to the side. COVID's not going away, but neither is climate, and there's always going to be something that could push climate to the side. But COVID has also changed the landscape, and we can use it as an opportunity for making change now. This is obviously going to require effort at all levels, and there's going to be a series of climate and health talks to go into a bit more detail about what's happening and what we can do. What I might do now is just ask if we can get maybe a top 3 things that Nick might recommend that we that we can do here, just to close off before we go to questions. So I'll hand over to Nick when he's ready for our top 3 things.
Sure. Okay. Top 3 things that individuals can do. Good question. I get asked that so often, and I must say I ask myself that so often as well. I think the simplest answer is you can think through 5 trillion different things you could do. Whether it is, you know, our own sort of clinical practice, whether it is our own lives, you know, as citizens, as voters. The absolute number 1 thing that you must do is the thing that you will do. And I think even though we could think through a million different perfect things, I would start with the thing that you will wake up tomorrow morning and do, and then wake up on Saturday and do, and Sunday and the day after that and the day after that. I don't think we need to be perfect. I think we just need to start taking small, simple steps forward together. That's my first thing. My second thing, clinicians have a pretty powerful voice. An incredibly powerful voice, one of the most trusted out there, hey? And an amazing ability to cut through, I think, understand large amounts of science, cut through that science, and then communicate it in a way that prioritizes something tangible, childhood asthma, human health, as opposed to something slightly more intangible, you know, the impact of climate change in terms of sort of CO2 parts per million, a CO2 equivalent up in the atmosphere. So your role in just having a conversation, just talking about it, talking about climate change as though you understand that it's a health issue, that it's an issue that as a doctor, as a health professional, it's something that you care about. And then I think the very final one is we become more credible as advocates against tobacco or any other health challenge if we start to take our own first steps. And so if there's something that you can do in your own personal life, that's my first one. Starting to have some conversations with people is the second one, but then maybe thinking what's the one thing that you can change in your own clinical practice to increase your credibility a little bit as you go forward. How's that? That's magic. We'll see what the audience thinks. Are there any questions? Anything else you'd like to ask while you've got Nick here? Rod Mountain's put a challenge to NHS Tayside here, that he challenges us to become a net zero health board and to include Tayside citizens on this journey. I think that'd be great if everyone could sign up to that. Got a question from Paul O'Mani. Now, how interlinked are the health boards in achieving this? Is the onus on Scottish Government or NHS Tayside? I might take that one, and Nick can come back if he's got any other questions. So there is linking here, but it's not at the level it needs to be. At the moment, we need further detail from the Scottish Government on how we get there. There is the NHS climate strategy at the end of the year. We don't have someone on each health board who is an executive member responsible for the climate on each health board, so we clearly need that. There is the opportunity for health boards to act individually. Ideally, it would be the health boards are all interlinking, but that will probably require the Scottish Government and this climate report, the Scottish
NHS climate strategy at the end of the year to give us the detail on how to do that. But I don't think we can wait for these documents or the government. I think we need to get cracking. Don't know if you've got anything to add to that, Nick.
Only if the question is whose responsibility is it, the answer is everyone's. Climate change is everywhere, it affects everything. And we can't wait, even though the solutions need to be enormous and at the scale of governments and at the scale of sort of macro, governance institutions. If we sit there waiting for that to happen, we're going to be waiting a heck of a long time. And so I think we all have a responsibility there to do our own piece within that. And that's how that system moves. It's about individuals moving within those big systems. Yeah.
Thank you very much. Any other questions? Oh, here's a good one. I understand there's now a collective called Doctors for Extinction Rebellion. What are your views on the role of civil disobedience in the response to climate crisis, given that governing bodies have repeatedly ignored advice and refused to implement changes? That sounds far too difficult for me. I'll hand that one straight to Nick.
Sure, with pleasure. I'll repeat myself. This thing is affecting everyone, affecting everything, affecting every part of society, and we need everyone to respond. Everyone is going to respond in a different way, and I think we should welcome all of those different responses. Civil disobedience, non-violent civil disobedience won't suit everyone, but that doesn't mean that it's not a good thing or a bad thing. I think all of those responses are really incredibly valuable. What we need to make sure we're doing is responding in every possible way, right? And so there's a role for some people to be doing that. I think there's a role for people to be taking different approaches as well. The one comment I would make is, in addition to that, is that we must make sure that we don't polarize. And we have a really, really difficult thing that we're trying to do right now, which is we are trying to say, hey, this is urgent. We really need to move quickly. This is affecting the health of people right around the world on Thursday, July in 2020. And at the same time, we need to bring people with us at pace and scale. And that's really challenging. And every now and then I get a little anxious that if we're not careful, we will end up polarizing that discussion. And the one thing we must never, ever do is line some of this up with sort of party politics. The biggest failing in the climate change movement in the United States is that they have made this a question of whether you vote Republican or vote Democrat. And that is how you lose this fight. We need to make sure that this is something that everyone can get on board with. And so whilst I'd support every single approach, I think we just need to keep that in the back of our mind.
Excellent. Thanks very much, Nick. Any other questions there? If not, we'll wrap it up. If you haven't already gone to menti.com, you could have a wee look at that website and click in a couple of responses. That'd be really useful information for us. I was hoping someone would ask about what Newcastle are doing, and I've got one more slide about some of the stuff that they're doing. They've been looking at all sorts of angles. An interesting one here is 74.4% of staff are aware of the sustainability work of the trust, and that kind of is the other mechanism. We know that things can change with law or money, but they can also change with the groundswell of opinion. So I think if we get the NHS staff on board and informed, that can really get things moving. And with that, unless there's any other comments, I'll close there. Thank you very much. Thanks again for joining us, Nick. Really appreciate your time.
Thank you. Take care.
Thank you so much. That's been brilliant.
Thanks, Rod.
Yes, thanks very much, Munro.
Thanks, Neil. Thanks for joining.